Hi there. I'm Dr. Percy Ballard, and I'm a Harvard-Trained psychiatrist and a Level 3 IFS trained psychotherapist. And today I'm going to break down IFS in around 3 minutes. So, as human beings, we function a lot like iPhones. And what I mean by this is that we all have the same basic operating system, which is the human nervous system, yet we all have different apps. And these apps are networks in our brains which cause us to think, feel, and behave differently. In IFS, there are three major kinds of apps. These are the apps that try to prevent suffering and pain. There are apps that react to the suffering and pain, and apps that carry that suffering and pain that we're trying to avoid. Examples of the apps that try to prevent us from suffering are the parts of us that might worry excessively to keep something bad from happening, or parts that stay quiet to avoid conflict or to avoid embarrassment, or apps that might stay in bed all day to avoid painful experiences such as failure. Examples of apps that react to our suffering are the ones that might react in rage when someone is hurtful to us, or apps that might use food, substances, or other addictive behaviors to try to help soothe our pain. The apps that actually carry the pain and suffering are often ones that we aren't conscious of, but they can manifest in us in flashbacks and nightmares, and sometimes we can just feel them as felt emotional pain. IFS is a system of helping us to hit the home button so that we can get out of our apps when they take over our consciousness, as though to see them now from the home screen as opposed to being in them. And this gets us into a natural state of compassionate self-awareness, which in IFS we often call self. From self, we are able to help calm our defensive apps and to access and debug all the apps that hold our emotional pain and suffering. After that, our defensive apps won't be as active because there's less emotional pain to prevent and to react to in the first place. So that way, we can better help to organize our apps to work better together as a whole unified system. So that summarizes IFS. However, if you do have more questions, please feel free to comment or subscribe below, or to visit my website for more resources. And that website is www.percyballardmd.com. Thank you so much.